Assalamu alaikum. This is Dr. Amna, and I want to discuss patient information leaflet of ovarian hyperstimulation syndrome. So, this is the information which you should tell the patient when you have this case in simulated patient task. So, you are supposed to tell the patient in layman language and educate the patient that what is she having and what complication we are anticipating and how can we manage and prevent those complications. So you will tell the patient about the condition. First, what is she having? As I have told before, that you will enter the cabin and you will take some history. Even if you know that this is the case of ovarian hyperstimulation syndrome, moderate or severe, you know the condition, it's written outside, but when you go inside, you take again history because it is supposed like that you have seen patient for the first time. So it's like in the hospital, you have already seen the diagnosis, but you again ask the patient to see is there any detail which should we know before making a management plan, because you are there to make a management plan. So you should again take history by yourself. And then in the history of OHSS, you will ask, patient will tell the complaint that I am feeling bloating or vomiting or whatever complaint she is having. They will give you the ultrasound and hematocrit level, so you can you can diagnose whether it's mild, moderate, or severe or critical. Obviously, they will not give critical. Um, and mild, moderate have outpatient management. So um, in the severe, you have option of either hospital or um, outpatient. If the patient asks that she cannot come for the regular follow-up, and if you think that patient cannot um, take a proper care of herself at home, then you can admit the patient. So I have told in the previous video that as a ST5 trainee, you cannot send the severe case of OHSS on your own. You know that patient has valid reason. You have assessed that patient can come back and patient is smart and educated and she can take care of herself. But if you want to send patient home, you will tell her the plan and you will say at the end of this consultation, I will ask my consultant to come and see you, and then you can but now we will discuss the plan. So what will you do after going back home? So you will explain the patient what is she having at that time. So you will tell her that fertility drugs usually are used to stimulate the ovaries, because this is the patient who has IVF treatment before and ovum has been taken, and now she comes with the complaint or that now I'm having this problem. So you will explain this to patient that fertility drugs usually are used to stimulate the ovaries during IVF treatment to make eggs grow. Sometimes there is an excessive response to these drugs, leading to this condition called ovarian hyperstimulation syndrome. For discussion, we can call it OHSS. Overstimulated ovaries enlarge and release chemical into the bloodstream. Fluid from the blood vessels leaks into your abdomen. Because of these chemicals, the fluid from the blood vessels leak into your abdomen and in severe cases into the space around the heart and lungs. OHSS can affect the kidney, liver, and lungs. A very small number of deaths due to OHSS has been reported. The risk is higher in women who have polycystic ovaries, are under 30 years of age, have had OHSS previously, get pregnant in the same IVF cycle as they get their symptoms, particularly if this is a multiple pregnancy, more than one baby. Most of your symptoms should resolve in 7 to 10 days if your fertility treatment does not result in a pregnancy. If you become pregnant, OHSS can get worse and last up to few weeks or longer. You have increased risk of high blood pressure with protein in the urine, and baby may born early. So if the patient is not pregnant, you can just say that most of your symptoms should resolve in 7 to 10 days. You don't have to tell that right now that if you don't have pregnancy. Obviously, you know she doesn't have pregnancy, but you can tell her that we need to cancel. We are supposed to not place the embryos in this cycle because because you have a risk of high blood pressure and protein in urine, and baby may born early, and preterm labor and preeclampsia. So you will say that I will inform your center as well, and inform them about your condition. So we categorize OHSS in 3 types according to severity of the condition by symptom, blood test, and ultrasound. We divide it in mild, moderate, and severe. You are having severe OHSS. So we will admit you. Your care is discussed and coordinated with the consultant. During hospital stay, we will measure your blood pressure, pulse rate, and breathing rate. We take an initial measurement of your waistline and check your weight to see whether the fluid is building up or reducing. If you are vomiting, you may need a drip to replace the fluid you have lost. We will monitor fluids you take and how much urine is how much urine you pass. Take blood test to measure how concentrated your blood is and how well your kidneys are working. Pain relief such as paracetamol or codeine will be given to you. We will specially mention that you will not take some special type of medicine. We call it NSAIDs. So you can mention that you cannot take Brufen commonly, which is used. Anti-sickness drugs to help reduce nausea and vomiting. Support stockings and heparin injections to prevent a blood clot in the leg or lungs. Heparin injections for blood thinning should be continued for 7 days from cure of your symptoms if you are not pregnant, or until the end of 12th week of pregnancy if you are pregnant. So if this patient is not pregnant, you will just say the heparin injection will be given for blood thinning and should be continued for 7 days from cure of your symptoms. So you, when you practice these station, you will learn that what extra information a patient does not need, because you know that if she is pregnant, she has to take it for 12 weeks, but patient does not know all the cases which present with OHSS. So if the patient says that, no, I don't want to stay, this is the management we will take. We will monitor her in the hospital. This is the main management. So if the patient say that I don't want to stay, or if the patient is of my moderate OHSS, so you can tell her that you can go home and you can take, we will give you anti-sickness medication, we will give you painkiller, but you don't, should not take Brufen and any drugs which are of that group, NSAIDs. And you will say that you will keep record of how much fluid you take and how much urine you pass. And also you will take only for the moderate OHSS, if there is no other complication, you will say that you will use stockings. So if the patient is severe, she want to go home or she is a moderate, she will say, when will I come back? So you will tell that these are basically warning signs. You will say when your pain is not helped by pain relieving medication and your condition is not getting better. If you start to vomit, having urinary problems or chest pain, or having difficulty breathing, you will be unable to attend hospital. If you are unable to attend the hospital easily for monitoring and follow-up, you should avoid having sex or during strenuous exercise to avoid injury to ovaries. So this is the whole condition that you will tell all these things to the patient. Normally, this is the end of the station. Just in case, these are mentioned in the these lines are mentioned in the patient information leaflet. So that's why I'm adding it here. How to explain paracentesis. Just for example, if you explain all these management. So patients say, I have read in the, I was going through Google and it shows that you might need a procedure called paracentesis, because when patient says that, it means that there's a mark for this answer. So you cannot say that you do not need this. When need arise, then I will explain it to you. No, you don't. You cannot say, because role player has asked this specific question. So you can explain that yes, this is needed in cases where your blood pressure, you are unable to maintain your blood pressure despite of adequate fluid intake, or adequate fluid is given to you by drip. Then and your kidney is not producing enough urine. So we can have this option of paracentesis. So if your tummy is tense and swollen because of fluid buildup, you may be offered a procedure known as paracentesis. A thin needle or tube is inserted under ultrasound guidance into your tummy to remove fluid. You may be offered a local anesthetic for this procedure. This treatment helps relieve discomfort and improve kidney function and your breathing. So this is all. Thank you so much.